Hello, my name is Louise Margaret Tomas, and I'm a nursing student here at LaGuardia Community College in the Registered Nursing Program. What I'll be showing you today is my e-portfolio. We'll be going through some parts of it. The e-portfolio you see behind me is actually a template that is geared for the Registered Nursing Program here. Behind me you see my introduction page. In creating my introduction page, I thought to myself, how would I want potential employers to view me? What did I want to tell them about myself? Since this might be how they're introduced to me. I thought to myself, okay, let's talk a little bit about who I am, where I'm from, how I got into nursing, and why I got into nursing. Also, I wrote about what I hope that they would find as they progress through my e-portfolio. What I love about the e-portfolio is before this, I basically had piles and piles of paper in my bedroom, which I had to kind of shift through if I wanted to look for a specific paper or a specific project. With the e-portfolio, it allowed me to kind of take all my work that I wanted to showcase off and place them onto a website, onto a server where I can access it, be it today, tomorrow, or even a year or so from now. Here in the Registered Nursing Program, when you go to clinical, each student is assigned a patient. That patient will be your assignment for the day. You are to assess them head to toe, which is very important in nursing, as well as take the abnormals and normals, find out research about the abnormals, create a NANDA-approved diagnosis, and above that, create a realistic and individual care plan in caring for your patient. When I place this up on my e-portfolio, what basically a future employer can see is that not only do I know how to assess a patient from head to toe, I know what's abnormal, what's normal, and I know how to prioritize my care plans. So without me even speaking a word to them, they can already see my nursing skill, which I think is important. There's also a part on the e-portfolio, which is the resume. In the resume, it's a basic resume where you can basically outline where you want to go, your work history, your work experience, your accomplishments, as well as your academic history. So even when I send out my resume to a potential employer, if they lose that one piece of paper, as long as they have this link somewhere, they can click and see my resume all over again. In my last semester here at LaGuardia, it was my honor and my privilege to be the nursing club president. As nursing club president, I thought to myself, what is it that I struggled with as a nursing student, and how did I overcome those struggles? Or how did my fellow colleagues overcome those struggles? So in my semester as nursing club president, I created, along with my mentor, workshops such as fluid and electrolytes workshops, nursing tool workshops, as well as a question and answer forum for international students to ask another international student that is working what paperwork needed to be filed, and so on and so forth. The legacy that I had hope to leave when I graduate is a nursing club wherein students networked with each other, where each student wasn't just responsible for themselves, but they helped each other out. The e-portfolio was actually introduced in my last semester here at LaGuardia in my capstone course. A capstone course is basically, as my professor described to me, a course usually presented in the last semester of a student's academic career here, wherein the faculty help them collect the academic tools that they acquired here at LaGuardia, put them in a little bag, and help them out the door towards greater goals and towards their dreams, basically. In this capstone course, we were required to do 2 different assignments, which I had no idea they would actually be related to each other for me. One assignment was basically to figure out our professional goals. Where did you want to be 6 months from now, 5 years from now, and 10 years from now? Which honestly I didn't know. All I knew was I wanted to graduate, I wanted my license, and I would go on from there. The other assignment was to create a nursing video wherein one classmate would play a patient and the other classmate would play a nurse. Good morning, Miss Clark. How are you?
I'm good.
Okay. So let me take a look at your chart. So I see here today you're coming in for a follow-up visit because you were newly diagnosed with hypertension. Is that correct?
Yeah.
Okay. Tell me, how are you feeling today?
I'm feeling fine.
Did you take your blood pressure medications?
Oh, you mean the pink pill that the doctor prescribed?
Do you have them with you? Can I take a look at them?
Yeah, sure.
Great. So much of nursing is teaching. Nursing itself is being a liaison, an advocate for the patient. When the doctor starts spitting out these long medical words and drug names, it's the nurse that helps the patient understand how to change their lifestyle, how, if a new diabetic, how to take their blood glucose level. So much of nursing is teaching an 80-year-old client why it's important to take a pill at a certain time, or even teaching new parents how to give their baby their first bath. I didn't realize this until I did this video, and I realized my professional goal was actually to obtain my bachelor's, then my master's, and hopefully come back to LaGuardia to teach future nurses. Now, what I love about ePortfolio are two very important things. Number one, what I love about ePortfolio are two things. The first one being is that this is a competitive world. Everyone has resumes, everyone has experiences. To me, this is something I have in my back pocket, wherein, especially since a lot of hospitals are becoming computerized in their record keeping, I can show them, hey, these are all my clinical skills that I know. This is what I know of nursing, and above and beyond that, I'm comfortable at a computer. So instead of the 500 hours of in-service you have to show me about how to open a computer and do my documentation, I may only need 10 or even 20, but that's about it. It gives me an extra leg up to the way I see it. The second thing that I love so much is my 75-year-old grandmother in the Philippines, who's never touched a computer before in her life, loves going to an internet cafe, logging on, and basically she can see what her granddaughter is accomplishing here in New York. And for that, ePortfolio to me is priceless. Thank you.